Have you ever felt like you had to face a problem that nobody could help you with? Maybe you've sat alone in your room, feeling like the only one struggling to get by. You're not alone, though. You're actually in the majority. A staggering 75% of high school students have faced situations like this, where they felt lost, but haven't felt sure where to turn for help. In other words, that's 3 out of every 4 friends you have. Whether the challenges you're facing are academic, emotional, physical, or mental, you can get help with them. In today's lesson, we'll explore how to identify these moments and seek the help we need. Let's get into it. Let's start by recognizing our different needs. There's academic help for when equations look like hieroglyphs. There's emotional and mental help for when our thoughts and feelings become tangled. And then there's physical help for injuries and illnesses. For many of these challenges, we have the ability to work through them ourselves. For example, there are many online resources to assist us with academic struggles, and our minor aches and pains can usually be remedied by rest and healthier habits. However, despite our best efforts, sometimes our health challenges can build up over time. We all experience feelings like stress, exhaustion, sadness, and confusion at some point in our lives. It might be brought about by a complicated relationship, a sports injury, an overwhelming emotion, or even just an intricate algebra problem. Normally, these problems are just temporary, but sometimes we might need help getting through them. To get help, we have to first recognize that we need help. But how do we tell the difference between a fleeting feeling and a more serious concern? Tools such as journaling and mood trackers can help us reflect and notice these patterns. Additionally, our friends and peers can provide valuable advice and help us see our problems in ways we haven't thought of. Chances are they're facing similar challenges. A chat with a friend can be a great way to decompress after a bad day. But if the bad days become a regular pattern, it might be time to consult with a trusted adult. The adults in our lives are our first line of defense. Parents, family members, coaches. We can talk to them for insight, but sometimes we might need more help than they can give us. In these cases, adults can help us find professional help. Academic counselors are a great source of support for both your schoolwork and any emotions it might bring up. If an academic counselor is not available to you, then tutors can be a great resource to help you with academic struggles. For issues related to mental health, licensed therapists and psychiatrists are trained to provide the support we need. And for physical health concerns, doctors are always there to help. They can offer advice, prescribe medicine, or refer you to specialists such as physical therapists or cardiologists to ensure you get the care you need. Then there are helplines, anonymous, judgment-free zones where you can talk to someone and know that your questions and concerns can be kept private. A list of some of these can be found in your PDF. No matter what issues we might be struggling with, there are lots of different ways to get help. But there's still one final piece of the puzzle: actually asking for help. This can be the hardest part of all, so it can be helpful to have a plan in place before we actually need it. Who will be your first point of contact when you decide you need help? Sometimes when we're feeling overwhelmed, we might not be in the best state of mind to think things through carefully. Simply having a plan in place makes it that much easier to get the help we need when the time arrives. And remember, just like how you might have needed to talk to someone to know you needed help, your friends and family can be in the same situation. If you're worried about someone, you can talk to them or another trusted adult about what you can do to support them in getting help. As we wrap up, remember this. Asking for help isn't a sign of weakness, but a mark of strength. It shows self-awareness, maturity, and the courage to improve. Recognizing when we need a helping hand, understanding the nuances of who to approach, and making a plan of action are all cornerstones of building a healthier lifestyle. In our next lesson, we'll dive into health advocacy, where we'll discuss how we can help build healthier communities. Until then, I'm Caroline, and remember, prioritizing your health is a choice you make every day, and it's worth it. So, keep building that healthy lifestyle, take care, and I'll see you next time. Hey.